I really value a public service that is available for everybody. I think that's really important for a society, that it is based on your need, not your ability to pay. And I think Sláinte Care speaks to that. Right care, right place, right time, and improving access for the public, and public having confidence in that public health system.
Martina Queally is the Regional Executive Officer for the Health Service Executive, Dublin and South East. She has over 30 years health service leadership experience and a particular expertise in strategic change management in public services and integrated service delivery. Throughout her career, she has led change, crisis and service transformation programmes. My name is Juanita, a Programme Manager with the National Quality and Patient Safety, and it's a pleasure to welcome Martina Queally as our guest on Walk and Talk Improvement. Martina, you're most welcome.
Thank you very much, Juanita. It's a pleasure.
You're one of the most senior leaders in the Health Service Executive in Ireland, one of only 6 regional executive officers. Could you tell us a little bit about your journey and why you chose public services as your career path?
I started out my professional life as a clinician. My background is in nursing, midwifery, and then I went on and did public health promotion. Actually, for a while, I was director of health promotion in the South Western Area Health Board. The journey was very much one of pursuing areas of interest and passion for me. I was attracted, I guess, into the profession because of role models I had in my own family. A couple of my aunts were nurses and I really looked up and respected those as I was growing up. That attracted me. A number of my cousins were nurses as well. That was always something that I thought was an interesting profession. And indeed, when I started nursing, I trained and then I went off to Australia. And I had a very interesting journey, and I found that there were loads of different avenues you could work in that were just fascinating in terms of delivering services to people. So I guess there was a real sense of purpose and value for me in my chosen path. And that has continued for me actually to this day, where I really enjoy and love my work and I get a real sense of purpose from it. I guess when I worked in Australia, it was my first interface working outside of a hospital system in community, and some of the public policy decisions made at that time, I could see the impact. There was a public policy decision to close large institutional care, and I found myself doing some work with an agency where they were trying to address the unintended consequences of that policy change. Like that began to pique my interest, I guess, in the interface between public policy and service delivery. So that's some of the background. Yeah. It's been a fascinating journey though.
Yeah, and you can hear your passion for it there. I'm really struck by the influence of those family members on your trajectory and on your decision to choose the public service. It brings us to that question, there is huge complexity and we talk a lot and we hear a lot about the negatives, but there's a lot that we do well within the system. What do you think we do well at the moment?
Well, I think, first of all, I would like to say that I think we have a highly educated and committed workforce, and I really welcome a public opportunity to acknowledge that. I see that every day in not just their dedication to their staff and to the people they're serving, but also in their dedication to improvement. Very recently, we had an integrated care conference and we saw example after example from right around the country of staff who had actually innovated, looked at ways they could improve access to care. That's one of the big benefits we have in the system, that we have this amazingly committed workforce, highly educated.
Yeah.
I really value a public service that is available for everybody. I think that's really important for a society, that it is based on your need, not your ability to pay. And I think Sláinte Care speaks to that. Right care, right place, right time, and improving access for the public, and public having confidence in that public health system. I think that's a wonderful thing we have in this country. I cherish it.
Yeah, that's a really important point. You touched on the impact of policy on the day-to-day lives of the population. How can we influence public policy so that it does meet the needs of that changing population?
Well, I think in every way we try to look at public policy and how it impacts. So, I think our health policy at the moment, Sláinte Care, the values underpinning it and the objectives in it are very laudable. I think it has cross-party government support, which is really important. So I think that's one of the areas But I mean, if we look at some of the big social determinants of health, things like housing, education, nutrition, diet, all of those factors have a huge impact on health. And we know education attainment has a very big influence on people's outcomes and health.
Yes.
And we also see those disparities in health outcomes where people are particularly disadvantaged. Now, of course, we can address some of those within the health services by trying to take both mainstream activities that reduce inequalities in experience and access, and also targeted measures. So things like ensuring that we are always conscious of health literacy and not making things overly complicated, and ensuring that we have complementary approaches for people who may suffer disproportionate inequalities. We do a lot of programs of work, undertake a lot of programs of work that try and address those inequalities. And I think even in terms of the new structures where each region has a Department of Public Health, and we are doing the population health profile so that we understand not just the overall population numbers and how it breaks down male, female and age, but we also understand how our population breaks down in terms of people who experience disability or people who experience social disadvantage. So each of our health units, our CHN, our community health networks, the managers in those units of delivery will have a full understanding of the population profile that they are serving. I think that's really important. It's a fairly fundamental building block of understanding and really trying to address the health needs of that population. That's a really new departure, and already I can see as an REO the benefits of having a public health department in the region.
As you said, it is fundamental. It's very hard to plan for a population if you don't know what their needs are. From one town to the next in Ireland is quite different depending on where you're based and where you're living and the population and so on. Just on that, what would you say is the most important quality and patient safety priority in our health services at the moment? And you've touched on a few things there in terms of the social determinants of health, but is there one thing that really strikes you as a core priority from a patient safety perspective?
Well, I think in everything we do, we need to be very conscious of patient safety. But in terms of having a really good understanding of risks where things go wrong, make sure we understand them, that we review and understand near misses or errors when they occur in our system. That's really important. And that's done in a very systematic way within the Irish health system. And I think that's really important. Obviously, we have a growing population and an ageing population. So making sure that our urgent and emergency care is responsive and that people get critical care when they need it is really important, and that people have access in a timely way. So we know that delayed care results in poorer outcomes. So we know that there are certain areas where our access, like if we look at some of the improvements that we've made, say, for instance, in cancer treatment, and again, that's one of the leading causes of mortality. And we've done really well through the National Cancer Control Programme in addressing how we deliver cancer services. And again, that has been informed very much by patient experience and sometimes by things we've gotten wrong, unfortunately. Our cancer control programme and the whole developments and improvements that have been associated with that have made a huge difference in this country. You can't take any of those advances or achievements for granted. You have to make sure that you continually attend to new evidence and emerging evidence and ensure that as your demands increase, that you're responsive and you can meet the needs as they arise. That is probably one of the areas where I think we need to make sure we always have an eye to new evidence, really good programmatic approach to how we deliver services, and then make sure our day-to-day operations is adequate to the task.
Okay. And I've heard you speak of that concept of no wrong door. Would you like to tell us a little bit about that?
Well, I think for me, that's very much around, again, getting the fundamentals right in terms of the organisation of our service delivery. I feel very strongly that our patients should not have to go in search of services, that if somebody comes in, that we need to look after their needs. And even if we believe that they've come to a mental health services and maybe they don't have a mental health problem, we need to look at what their needs are. So it may not be a formal mental health service. That doesn't mean the person isn't in psychological distress. So it is about trying to support the people in addressing their health needs. because even though it may not be a very serious issue in our books, it's obviously causing the person significant distress. So I think that idea of if the person is looking for service, we need to have a very clear pathways of care for patients and our service users and clear signposting so that if they need to transition from one service, we talk about seamless services, and those transitions of care to speak and quality and patient safety sometimes can be problematic for people. So we do need to try and make sure that we remove those barriers for patients that are using our services.
Yeah, and it is really important. I think if someone has taken the time to contact the services, there is a need there. There's something that has provoked them to go. So it's being able to direct them to the right space. We talk about that quality and patient safety culture, and continually we talk about improving quality and patient safety culture within the health services, and it's that continuous cycle. But what sort of critical success factors should leaders focus on?
I think there are a number of things. I think your timeliness of access is really important. I think your whole training and education and organisation of the kind of quality of care you have in place. So, for instance, that you have the right teams involved in delivery and that you continue to try to improve the skills and culture within an organisation is really important as well. So, the whole attitudes and how people feel cared for. And we know that actually in where we have a compassionate culture towards staff, that actually the quality of care is better. I don't know if you've come across Michael West, but that whole sense of compassionate leadership so that we have that psychological security, safety, trust in teams. All of those things are really important. I know from a very young clinician, the biggest thing you wanted to avoid was people being afraid of saying, I've made a mistake. Because unfortunately, errors will occur. And the one important thing we need to ensure we have in our system is that somebody feels safe to say, I've made a mistake.
Yeah. I'm always struck when I look at Michael West's work. It's interesting, there can be sometimes a perception when you think of compassionate leadership or compassionate kindness in the workplace. Some people can be very skeptical and think, well, we'll get nothing done, or that's not going to help us achieve anything. But in actual fact, the evidence would say that it leads to greater positive outcomes in a patient safety space.
I believe it does. I mean, I think in the HSC, our own programme of values in action was actually a very good programme that helped people become very aware of how they show up themselves.
Yeah.
And particularly leaders and managers, how they show up for their teams. You know,
Yeah.
like even in a very stressful environment, trying to create that sense of psychological safety where people know they can. And I think actually when you manage to do that, you get a lot more innovation.
Yes.
And a lot more productivity, because I think people that feel unsafe and unhappy generally try and protect themselves and often, won't put their hand up and say, I think we can do this better. I think we can make a change, because they don't feel it's safe enough to do that. So certainly from our own team here, we're very much trying to build that culture of improvement and engagement right across the board with our staff, but with our service users as well and our patients.
Yes.
That we're informed in terms of, if they feel there are changes we can make. We have our patient service user engagement programme of work commencing, which is again another really important feature of the new regions. And it is to take that to its highest level in terms of really listening to feedback, because it's like the mystery shopper. Our patients use our services, they see it from the front door to the back. They are the people that can tell us this is actually a waste of time or that's really good.
Fabulous.
Finding ways to really understand that experience and learn from it is really important.
Yeah. Sometimes our expectations of what we think somebody wants versus what they really want are totally different. And sometimes it's actually easier to do what the patient wants.
Yeah.
Because we can put hoops in place that aren't necessary at times. Talking about compassionate leadership and encouraging that space of innovation, there's a huge change within the system at the moment as we're looking at integrated care. And in particular, you have people that maybe are working together that have never worked together before. They might have different styles of working. So how can we support the building of relationships there so that we actually have trust enough to be able to share and voice ideas and work well together to make things happen?
There's a number of ways. I suppose first it is building that culture again of mutual respect and really understanding when you bring a multidisciplinary team together that you have a very eclectic mix that can bring a lot of different perspectives to the service you're trying to build.
Yes.
And I think increasingly people really enjoy that kind of work environment because they do learn from each other. And when you look at some of the integrated care programs, you really see that in spades. And that leads to a greater sense of satisfaction because obviously when the service users and patients are happier with the service, staff get a real sense of satisfaction from that. So we see that right across the board,
Yeah.
whether we're looking at our primary care teams, our children disability network teams, our mental health teams. We are building multidisciplinary teams and really lovely examples of it as well in the integrated care programs around chronic disease and older persons. That lovely blend of skill and expertise and perspective leading to us being able to build much more innovative ways of delivering care and treatment. And of course, building, I think, much stronger relationships with our partners in GP practice and practice nurses as well. I think even if we see some of the work going on vaccination across community pharmacy and the skills and benefits our community pharmacy can bring to offering broad programs, I think that's all really important.
Just on that, you talked about sometimes that there can be a fear of taking action or a fear of taking risks or making mistakes. And when we think of sort of the traditional leadership within the HSE, and I think it's evolving, has been sort of that control and command leadership. And there can be a time and place for it, but it can actually inhibit action. How can we ensure that as that leadership is changing and as people are moving to new ways of working, that they're not afraid to take risks or afraid to fail? That sort of intelligent risk taking. Is there anything we can do to support that?
I do think it is about building that kind of environment and culture where you have that openness to listening to staff, to hearing what it is they're trying to do. But also this kind of very practical things as well. Again, another feature of the new regions is the reef planning and performance teams.
Yes.
They sit as part of the regional team. The idea is to build the capacity. So there's methodology around service improvement. So if somebody comes and says, look, I think we could do this better, that we adopt a kind of a structured methodology. So it's almost providing a scaffolding around people to say, okay, we're not meeting the targets on a particular area. We can work with you to look at how we can improve that whole service or access in that service.
Yeah.
And it is providing some of the like evidence-based methodologies around service improvement and supporting the team, whether it's rapid improvement event or whether it's a full scale, like where you're looking at your process maps and you're looking at where there might be areas of waste or looking at areas where we know we're missing a beat around the full pathway of care. And it is very much around engaging with your stakeholders, looking at your pathway of care, looking at areas where we improve it, and sometimes reorganizing teams just even within existing resources without looking at anything additional.
Yes.
It can have a major impact. And we've seen some lovely examples of that through the work of the team. And again, some really good examples of that displayed at the Integrated Care Conference. But we've seen it here in areas like dentistry and ophthalmology. Modernised care pathways made a huge difference actually right across the board. I think it's two-way and probably even more than two things. But one is that culture and that environment where you're heard when you say there's something wrong. People come at it in a spirit of curiosity. I think that's really important, that whole sense of appreciative inquiry.
Yeah.
So that when we say we're not missing a target, rather than just kind of beat ourselves up over it, we say, well, what can we do? And we approach that in that spirit of cooperation and inquiry. And indeed, lovely work with our partners and in terms of the integrated care programme. Dr. Anya Carl spoke to us recently and around some of those principles of integrated care. And of course, one of them is that transparency of results, that we're not afraid to really understand our results, even when they're not what we want them to be, and say, how can we do better?
Yes.
And really, again, embracing that whole principle of partnership with our staff and also partnerships with our clients, so that we really understand their experience of the service. Looking at new evidence, all of that's really important. Having the machinery, if you like, in your gift, where you have a planning and performance, people who have expertise in improvement that can support staff on the ground. For our staff as well, celebrating success and not beating ourselves up if we do fail at something, even if we try it, that we look at that as another opportunity to learn from the failures, celebrate the wins, like really understanding what can work well. And then I think one of the areas we need to get a lot better at is scaling what we do know works well.
Yes.
So sometimes there's an artificial competition in the system, I think, where rather than sort of saying that thing worked really well, I'm going to repeat it, I'm going to do it again. You say, I'd like to do something different or new.
Yes.
I don't mean that in any negative way now, but I mean, like, if you see something that works really well, just do it.
Adapt it.
Just try and see, can you do that? It doesn't have to be a different version of that. It can be exactly the same. It can be, just doing the same thing.
We can be very territorial, I mean, in Tipperary, we might
Yeah.
like to do things a little bit differently than they do them in Cork or Galway or,
Yeah.
west of the Shannon. There's a bit of that, I think, over
Yeah.
time. But it is. But also as well, I think there's something about finding out about what projects are out there.
Yeah.
Because sometimes, it might be 3 years later that you suddenly hear that they did
Yeah.
something and you said, well, actually, we spent 6 months trying to design that. And if we'd known that was in existence. So
Yeah.
there's something about how we share what we're doing as well.
Yeah.
You talked a bit about the access to the performance and planning teams and being able to access the resources that are there and the knowledge that they have.
Yeah.
One of the things that we're doing within NQPS at the moment is supporting the development of quality coaches across the system.
Mm-hmm.
So that they're developing coaching skills so that they can do this type of work with their teams and, nearly a form of leadership with your team, that you're actually supporting them to do the work, sharing methodology and tapping into, I think, broader than quality improvement, because we need to know about the change management resources and we need to know about human factors and we need to know about implementation science. So tapping into all of those things.
Yeah.
How important do you think it is for leaders in the system to have some of that expertise themselves, in addition to knowing where they can access it?
I think it's very important. I would say actually having those kind of quality and patient safety and service improvement skills, and undertaking education and training myself in those areas was hugely important for my own personal development as a service leader. You can completely understand the practicalities. And that's not to say that every leader has to do it, but I think for me personally, having that education and training and understanding was very important.
Yes.
Certainly has helped me personally. The program I know they did in the College of Physicians, where they did triads and, you had clinicians and people kind of going in and doing a project in threes. I think that worked very well. I think there was a lot to be said for that. Because people were using very real life examples of stuff that matter to them, and they were using it as kind of action projects to incorporate their learning in an academic course in a very real way. And I saw some lovely projects come out of that particular educational environment, and I think it was very beneficial. So I think the whole idea of coaching and mentoring and supporting,
Yeah.
we've seen that over and over again. A person can go off and do a training for a week or even a year and find that they still don't really have the confidence to actually do it. So there is something about having that almost scaffolding around people that they build that confidence.
Yeah, I agree completely. I think there's something about the confidence and also the mandate.
Yeah.
I think, we've seen a lot of people have come out and they've done the postgraduate certificate with the RCPI, which is still available to people if they're interested, and a fabulous, fabulous course, but they mightn't feel they have the mandate to go ahead and to share that with others. And really what we want is people to feel that they have the autonomy to actually act and that they can support others and that you don't have to wait for permission to do that.
One of the other things as well is that we tried to do, I suppose, to encourage people not to be afraid to using our project management team and building a portfolio of improvement projects so that people could see where other people were doing it and perhaps learn from them.
Yes.
But also get support from the project management team to set their project up and perhaps write it up, more importantly, so that both their managers and other peers could sort of say, we can learn from that, and they can also demonstrate impact themselves. So I think that was really, really important, having that kind of almost formal support for people, as well as the cultural environment and maybe the strategic aspirational element to it, like in terms of, say, the principles of integrated care, principles of launch care, the guide and support people in terms of their approach, but then a very practical, almost academic framework that they can use as well to guide their practice.
And I think it's that balance of the practical pieces. I know a lot of people have done projects over the years and haven't written them up because they haven't had the time. They've moved on to the next thing.
Yeah.
And the information, the knowledge can get lost somewhere in the system.
Yeah, absolutely. Yeah.
We talk about the work that's underway at the moment and, adding value and making sure that it's sustainable.
Yeah.
One of the things that I've seen, Don Berwick has talked a lot about is looking at the processes that don't provide value or that they're low value and they don't add value to the system. We continue to do them.
Yeah.
I've seen examples in the past where we introduce a new process, but we don't stop doing
Yeah.
the old thing we're still doing. I used the example years ago. There was a colleague of mine and, she'd started using Excel, but she was still adding everything up with a calculator. Now, that's a long time ago, but it's the perfect example of the dual process.
Yeah.
What can we do to support people to review what we're doing, that we're not creating something new all the time, but we're actually stopping sometimes and saying, is that process still serving us?
Yeah, it's a really interesting area, actually. I wish I had a very good answer for you now, but I'm not sure that I do, to be honest. I do think it's hard to uncover them sometimes.
Yeah.
It's almost like habitual behavior. We've always done this. We better not stop, because what if somebody comes looking for that folder and we don't have it anymore?
Yeah, the risk. Yeah.
So there's almost like,
The fear.
again, I think it is almost that permission to say, do we need this?
Mm.
Where does it go? Whoever looks for it. And almost this
Yeah.
fear of stopping collecting that information because we've always collected it. And what if somebody comes and looks for it?
Yes.
And yet we know that if we look at some of those processes, they're not necessary. I think sometimes some of the work we're doing, and there's quite a bit of activity in the whole digital and automation. And I think that's probably one of the ways that will help us
Yes.
to uncover redundant process, really. We did a bit of work some time ago because we were looking at particularly management admin resource, which can be very scarce and have multiple demands on it, and actually a poor public appetite for funding also. So we were looking at trying to evaluate our management admin resources and processes to make sure we were using our skilled workforce, and they are very skilled, our administrators,
Yes.
and frequently have built up significant skill over years. So our whole idea was to try and identify if we had redundant processes like you described, or duplicate processes, or actually newer, better ways of doing it, and hadn't either all gone to the better way or leaner way. Now, it proved quite difficult,
Oh, yeah, yeah.
but I do think some of the digitalization we're doing and innovation around digital technology will enable that. Now, big thing we have to be careful of is that we don't just digitalize poor processes. So I do think there is a discipline required around ensuring that as we move to more digital, that we don't just digitalize, we transform,
Yes.
because I think that's big risk.
Yes. It resonates. It's a while ago now, but the PPARS project, I'm not sure if you'd have come across it back in the day, but one of the biggest challenges at the time, I worked in a communications role back then on the change team. And one of the biggest issues was there were a myriad of processes and there was no standardization of the processes. So they built the system for all of those different processes. And we might have been trying to do the same thing, but there was a workaround here and there was a workaround there and there was no standardization of the process. And it failed purely because of the complexity of that.
It's the big risk with any big digital transformation you're doing. If you build in too many poor workarounds,
Yeah.
instead of actually rectifying the position, it's problematic.
It doesn't work.
Yeah.
I just wanted to come back, if you don't mind, just to that piece about equity of care and access. And obviously, in the context of the new regions, how do we maintain equity of care and access? There's always the fear, I think, when there's regionalisation that people will work only within the region. But how do we ensure that we don't end up with inequity across the country?
Well, I think first of all, there's a principle underpinning the establishment of the regions that all 6 REOs are completely honouring, I would say, in my experience over the last year and a half, a little over it now. And that is that pathways of care that are established, like we've a number of national and regional centres. So we would see pathways of care that have been established across some of the major academic teaching hospitals in every region. And those are all maintained and honoured. Certainly, I think about it, and I think a lot of my colleagues are the same. Our population in a number of ways. We think about it first in terms of the population of the country. So we are a national system, although there are 6 regions. We are part of a national system and we honour that national obligation, and that's really important. So if I'm under pressure over in one of the acute hospitals on a Friday evening, but there is a person from the other end of the country
Yes.
who needs to go to one of the national programmes in one of those hospitals, well, then they need to go. It doesn't matter. That's where they need to go. There may be some disruption to access because of pressure, particularly on urgent and emergency care.
Yes.
But we definitely try to mitigate that. And our clinical directors and our clinical leaders in the system are very involved in ensuring that people who need urgent care get it. And that's sometimes scheduled, urgent, scheduled care as opposed to unscheduled care. So that's really important. We know it's not all equal. So when we look at the distribution of resource, we know that some areas have slightly more than others. That doesn't mean necessarily though that they have too much, just they may have grown a little faster or a little better than some other sites for a variety of reasons.
Yeah.
So there is a requirement within the region, I guess, to prioritise resource. So for instance, if I look at an area and I see that they have poor access to whether it is mental health services or older person services or whatever, well, I need to prioritise and work with my regional team to ensure we prioritise that area, whether it's for development funding or sharing of current resource.
Yes.
But there are a few areas I would say that have too much resource. So it very much is around building it appropriately. So maintaining good pathways of care, maintaining access to specialist centres is really important. And then ensuring as we build a population health approach to it, that we look after all areas of the country. When we look at the enhanced community care programme, they were very good at looking at the distribution of resource. So they looked at the development of community health networks, they looked at the development of integrated care programmes, and they distributed those according to population. Now, of course, over the course of time and with pressure on funding and WT and limits and all the rest of it, we've lost some of those resources that were originally intended. There is a requirement for us to try and prioritise some of those areas where we want to develop those kind of integrated care approaches and how we're going to do that. That's obviously not something you fix in one funding cycle, it's something you fix over time. But one of the important things is that you have your system set up so that you understand where your need is and how your resource allocation gets distributed evenly.
Okay. And as part of that, do you think that there are things that we could be focusing on with that future design lens to support service delivery in the longer term for the changing population?
Well, we definitely need to focus and absolutely maintain and keep a focus on prevention. So we know that there's quite an amount of areas where really good evidence-based early intervention not just mitigates risk factors, but supports and promotes recovery.
Yes.
I absolutely think, in terms of fundamentals, keeping a firm lens on the prevention and promotion of individual health is really, really important. And we can see some really good examples of that. Like if you look at our diabetes program and respiratory programs, seeing some really strong evidence of where earlier intervention by GPs, earlier diagnosis of either whether it's cardiovascular or blood sugar discrepancies, and that earlier education with patients and service users mean they can take corrective actions on diet, exercise, weight management.
Yes.
And we're seeing evidence of that early intervention with our GPs and our community programs working really well. Also, lovely examples in mental health of recovery and earlier intervention having really good outcomes for patients. So I think for me, that has to remain a priority of that. Even when we look at the cardiology program, the cardiologists in the integrated care programs working much closer with the GPs and their multidisciplinary teams to ensure that that earlier intervention for patients with problems is really, really beneficial. That's one area. Probably another area is that we continue to look at that whole innovation. When we look at some of the lovely examples in early childhood education and training, or like a lovely example from one of our teams down the southeast on a speech labs where they did a lovely program for speech therapy that was IT-based program and really empowering for parents, for other family members, teachers, childminders, all get involved in actively in the speech therapy for the child. So really good innovation, but very, very impactful in terms of the outcomes for the children.
And practical.
Very practical, yeah.
My daughter, when she was in creche, she was probably 3 or 4th time, and she came home and said, "Ma'am, are you drinking a can of Coke? That's very unhealthy." And
Yeah,
it's a really small thing, but at that age,
yeah,
they're like sponges and they pick it up, and their lifetime behaviors that's hopefully will stick with them.
yeah, yeah.
And they're small things. Yeah, they're small things.
But even, when we look at our aging population, our growing population, like things like physical exercise, and increasing the overall population,
Yes.
getting Ireland active. It was a very good program, but just increasing people's awareness of how active they need to be to gain that health benefit. An awful lot of people wear wearables now. And of course,
Yes, yeah.
before you start counting your steps, you probably think you do a lot of walking, and then all of a sudden you count them and you realize actually
Yeah.
not nearly as much as I thought. So there is a kind of an awareness raising, I think. Now, equally, I think we need to be very careful that where you have areas of social disadvantage, that you begin to close the gap in a different way. So for us here, programs where we work with disadvantaged populations, we would look at some of the really good programs we have in conjunction with our traveller health units and our traveller organisations.
Yes.
Developing peer support workers that bridge that gap sometimes around culture and literacy and cultural barriers that might exist around even simple health information that we could take for granted, but really understanding, when we look at our migrant population, having really good translation services, and again, having peer support and community workers that can build trust with those populations and understand where there might be inherent fears. Some of the populations are very distrustful of things like vaccines because of historical reasons. So we have to build those programs of work to ensure we build confidence, trust, understanding. That's one area. That whole area of prevention is very, very significant.
Yeah. And access is much bigger than access through the front door.
That's right. Yeah.
It's all of that.
Yeah.
The other elements of it and the complexity of it, and even from a staffing perspective, being aware of sometimes the cultural context can change how you might engage with somebody. So there's that side of it as well, which is complex. When we talk about the work in general, how important do you think having a collective vision or values are as critical enablers for the type of work we're doing?
I think it's actually mission critical, to be honest. And I do think our values in the HSE of compassion, care, trust and learning are really good. Certainly they serve me very well.
Yes.
As a leader, I come back to them and I won't say that I honour them every day, but I try to honour them every day.
Yes.
And I think they're really good core values that can help people really try to bring their best of themselves to work every day and also bring you home when things are going wrong.
Yeah.
What's our why? Why are we here? Why are we trying to do this? What are we actually trying to do? What problem are we trying to solve? The mission and vision for our services and the values are really critically important because they are what we come home to.
Yeah.
And all of the service improvement, all of the service design, everything we talked about earlier, they all are underpinned by our vision, our mission, our values.
Yeah.
And also our policies that we're aligned. We are prioritising the policies we know to be impactful, to have the highest benefit to the population we're serving. So those things are really important. Otherwise, in spite of a big team and big investment, we'll dissipate the results because they won't be focused.
Yeah, there's that piece, it's fundamental to how we make our decisions as well, to keep that in our mind. And you talked at the very start of this around thinking about policy and how policy impacts delivery and experience. And there is something about how does it align with those values and how do we actually translate that into a reality?
Yeah.
And I'm going to ask you that next question. How do you translate that vision into a reality when you've got X number of staff across a system with diverse values and diverse ideas about what we need to do? How do we ensure that we're all looking in that same direction?
I think having a good policy direction, so having a good document like Launch Care, like some of our other policy documents that guide our practice is really important because those policies are developed in a very participatory fashion. We have a pluralist approach to developing public policy, thankfully, in this country. And so those are policies that are shared. Actually having the vision for what we're trying to do. I mean, the whole shift left, care closer to home, but yet very good evidence-based programs and like in line with our clinical programs, they're really important because you will get disparate views. So you have to be able to bring people home to something that is tangible and that has been agreed. And then I think the values are very motivating. So it is about bringing people together around those shared values in terms of what we're trying to do. Even though people's ways of trying to achieve the goal might vary, I think in general we have a huge coherence in the region around what it is we're trying to do. Even hard stuff and things that are difficult and targets that are difficult to reach. People get behind the why they're important. They're important because we want to give people access. We want to maintain the safety and quality of our services. We want to ensure that patients can trust our services and the quality of it. So even when we're really pushed to achieve a target and to get over the line on a target, we all know why we're doing it. We all know why it's important.
That's it. And we're living in the communities as well where the services are being provided.
Yeah.
There is that motivation when you're looking at this. It is for ourselves and the future. You've worked obviously within the health services for over 30 years, and I'm sure that, you talked about hard times there and you've talked about some good examples as well, but in your own experience and your own personal leadership journey, what has sustained you when it has been difficult, or equally when there's been opportunities there and there's been a new challenge presented that you're saying, gosh, this is bigger than I've done before? What sustains you and keeps you motivated in that space?
It is my sense of purpose and value in what I do. I remember one of the staff, we'd come out of a particularly difficult day, and she turned to me and she said, "How do you do it day in, day out?" And I said, "Because it's worthwhile. No matter how long the day or how difficult the day is, I never walk out the door of the building or the service and think that was a waste of time."
Yes, okay.
I don't. It may be that it didn't go according to plan, or it may be that we didn't get it right, or it may be that we have to go back and start again. I'm not saying they're all good results every day, but it's always worth doing.
Yeah.
It's always worthwhile. It's always the sense of purpose and value in what you're applying, your intellect and your effort. And for me, that's really important.
Yeah.
It's just really important. I don't like to waste my time, and I don't like to do things that I don't feel there's any inherent value in them. But I love to do things that I think are important and add value.
Okay. And if I was to ask you just over that experience, are there things that you would say, this was a key core lesson for me, and these are my top tips for somebody that's coming up the ranks or that's sort of looking and seeing, well, what am I going to do to improve quality and patient safety in my area? Those leaders and aspiring leaders in the system, what would you be saying would be advice for them?
The first thing I would say is always approach with the sense of inquiry. You know that old saying, you never step into the same river twice. Because even if you are like deeply experienced and you know a lot of stuff, things change, situations change, it's a new person, a new team. You have to approach it with the spirit of inquiry and also a spirit of, can we do it better? Can we do better? Also, I think with the sense of openness, you don't need to know everything, right? Other people bring loads and loads of expertise, different experience. And for me, one of the great pleasures is experiencing that disparate experience
Yes.
coming together to find new solutions. It's really exciting when you find people coming in from different areas with different life experience, different service experience, and they bring that to this new situation. And so that means that it's always interesting.
Yes.
My advice would be, the gurus in quality and patient safety say we've two jobs. One is to do the job and the second is to improve it.
Yes. Yeah.
And I think that's lovely, because you just don't come in and out. You come in to do the job, but also to look at every opportunity for doing it better,
Yeah.
bringing something new, doing something better. You're not alone. You are working with other people. And there's a great energy about that, a great energy about that collective intellect and intelligence coming together to find solutions. I love that.
Yeah.
I would say to people as well, watch where you get your energy from when you're coming to your work and your job. So I think coming with the right attitude is really important, but also be aware of yourself so that you read yourself. If you're coming and you're finding yourself in a place every day, ask yourself, why am I like this today? Why am I showing up like this? What is it that's triggering these reactions in me? So that self-awareness is really, really important, particularly if you have ambitions to lead a team. You have to be self-aware. And like these days, we're all not aware at all of ourselves and, completely unaware of ourselves some days. I think to try and do that is really important, and to appreciate everyone's contribution and listen. They'd be my big top tickets. Keep your spirit of inquiry, be self-aware, be open to the opportunity, like open to what's coming towards you. Like every iteration of the health services I've been through has been good.
Okay.
Every iteration of it has brought us to the next place. Every place we found ourselves has helped us to develop to the next level.
Yes.
And I think that's really important, trying to learn from those experiences and bring them with us as we go forward.
Yes, yeah. Thank you so much. Is there any final message you'd like to leave people with?
The big thing I think is really important is to build a sense of pride in what we do. When we look at Ireland, I don't know where I got this from, but it's not of my own making. I didn't dream it up. But somebody said we should make a hero of our size in terms of this country. Because as I said during the course of the interview, we have a highly educated and dedicated workforce. We're big enough to make a difference and to grapple with some of the problems that every country is grappling with in terms of health services. We're big enough to grapple with those, and we're small enough to grapple with them, if you like, and big enough to make them count. So I think there isn't any country that has fully cracked integrated healthcare. We're very well primed to do it in Ireland as a country, not in any one region, in every region. As a country, as a collective, I think we're in a very good place to do that. And I think we're small enough to do it and big enough to make it count.
Thank you so much. We're going to come to the end of the episode. I'd just like to say thank you so much for sharing your wisdom so willingly and your experience as well. It's been such a privilege to speak to you.
Thank you very much, Juanita. A pleasure.
As we come to the end of this episode of the Walk and Talk Improvement podcast, we would like to thank Martina Queally for sharing her wisdom and experience so willingly. It has been such a privilege to speak with her on these topics. For you as a listener, we hope that Martina's insights will continue to inspire you in your work to improve health and social care services. We hope you enjoyed this episode, and if you would like to hear more content like this, you can listen to the Walk and Talk Improvement podcast wherever you get your podcasts. Thank you for listening.